Attention seniors, think fish is always a healthy choice? Think again. You might be unknowingly eating your way to a health disaster. While fish is often praised for its omega-3 fatty acids, some types of fish may actually be putting your health at serious risk. Discuss the common belief that fish is the healthier option, especially for seniors. Provide background on how fish is often recommended for heart health, cognitive function, and general wellness. Introduce the shocking twist: not all fish are created equal. Highlight that some are packed with mercury, other toxins, and allergens. Explain why seniors are especially vulnerable to the dangers of mercury poisoning, heavy metals, and toxins found in certain fish. Make it personal. As you age, your body becomes less resilient to these toxic substances, and the damage can be irreversible. Mercury levels. How mercury affects cognitive function, heart health, and the immune system, especially in seniors. Toxins. Other harmful substances that accumulate in certain fish. Allergens. Some fish are more allergenic than others. High-fat fish and their potential effects on weight gain and heart disease. Fish 1. Swordfish. Mercury levels. Swordfish is notorious for high mercury levels. Effects on seniors: cognitive decline, increased risk of heart disease, and possible developmental issues in children if consumed by pregnant women. Other risks. Swordfish are large predatory fish that accumulate toxins in their tissues. Fish 2. King mackerel. Mercury levels. King mackerel contains dangerously high mercury concentrations. Senior risks: damages brain function, increases the risk of heart attacks and strokes. Alternative: safer mackerel options. Fish 3. Tilefish. Overview of tilefish. Not widely known, but notorious for accumulating high mercury levels. Dangers: tilefish caught in the Gulf of Mexico have some of the highest mercury content. Senior vulnerability. High toxicity can severely impact kidney function and cardiovascular health. Fish 4. Shark. Mercury levels. Shark is at the top of the food chain and accumulates large amounts of mercury. Long-term effects. Chronic mercury poisoning can lead to neurological damage, kidney failure, and developmental issues in pregnant women. Risk to seniors. Increased vulnerability to cognitive issues, memory loss, and heart disease. Mercury levels. Albacore tuna, especially the larger varieties, contain significant mercury levels. Health risks. Increases the risk of heart disease, dementia, and kidney issues. Safer alternatives. Canned light tuna as a safer option with lower mercury content. Fish 6. Orange roughy. Overview. A deep-sea fish that has been known to accumulate high mercury levels. Dangers. Orange roughy has a long lifespan and a slow rate of reproduction, which means it accumulates toxins over many years. Effects on seniors. Increases the risk of kidney damage, cognitive decline, and heart issues. Fish 7. Big-eye tuna. Mercury levels. Big-eye tuna is a larger species and tends to have high levels of mercury. Health risks. Increases the risk of neurological damage, cardiovascular disease, and developmental issues in unborn babies. Safer options: light tuna or wild-caught smaller tuna varieties. What is mercury? How it enters the body through fish consumption. How mercury is absorbed and stored in tissues, particularly the brain, liver, and kidneys. The timeline of mercury poisoning in seniors. Slow, cumulative effects that worsen over time. Cognitive decline, memory loss, confusion, and concentration issues. Neurological symptoms: tremors, anxiety, and depression. Cardiovascular issues: increased risk of heart disease, high blood pressure, and stroke. Kidney damage. Chronic kidney disease due to prolonged mercury exposure. Aging body, reduced ability to detoxify and flush out toxins. Weakened immune system. Seniors have a less efficient immune system, making it harder to combat the effects of mercury and other toxins. Decreased liver function. As seniors age, their liver may become less effective at processing heavy metals. Cognitive decline and dementia, a major concern for older adults. Cardiovascular disease. The link between mercury exposure and heart disease. Weight gain and hormonal imbalances. How certain high-fat fish can contribute to obesity and metabolic disorders. Salmon. A great alternative for omega-3s with low mercury. Sardines. Packed with healthy fats and very low in mercury. Anchovies. Small fish that are rich in nutrients and low in toxins. Herring. A sustainable and healthy fish with minimal mercury contamination. Look for smaller fish species that live short lives. Prioritize wild-caught fish over farmed varieties. Check local guidelines for safe fish consumption based on regional water pollution levels. Recommended weekly fish intake for seniors. Balancing omega-3 intake with mercury risks. Rotating fish choices to minimize toxin exposure. Omega-3 supplements, when and how to use them safely. Plant-based alternatives, flax seeds, chia seeds, walnuts, and algae supplements as omega-3 sources. The role of a nutritionist in determining safe fish consumption. Understanding the impact of overfishing and environmental toxins. How eating lower on the food chain benefits both health and the environment. Sustainable seafood certifications. How to identify responsibly sourced fish. Creating a balanced diet for seniors. Focus on plant-based foods, whole grains, healthy fats, and lean protein sources. The importance of variety in the diet. Minimizing reliance on any one food source. Consulting with a healthcare professional before making drastic dietary changes. The hidden risks of consuming certain fish, especially for seniors. The importance of avoiding high-mercury fish and choosing safer alternatives. Empower your audience to take control of their health by making informed choices. Encourage watching the video until the end to discover safer options and maintain optimal health for years to come.